Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us again.
Thank you for having me on the program.
Yes, sir. It's been a few days since the country began its COVID-19 vaccination of frontline workers. What are some of the feedbacks that you've been receiving thus far?
I think it has been quite positive. Most of the persons that I spoke with were very pleased to get their first dose of the vaccine. And talking to them about some of the side effects, a few people had maybe some irritation at the site of the vaccine. Others experienced a little bit of headache. Others might have had some chills and fever. But by and large, within a 24-hour, most of these things have subsided. So the reaction has been good, and people were quite pleased that we were able to get the vaccine for them, and they have been coming to get immunized. Yesterday, for example, we did about 313 more doctors and nurses. So I think people are coming forward to get the vaccine. At this rate, we would exhaust the initial supply that we have received, but we're working to make sure that we can get more vaccines by the end of the month.
All right. As you mentioned, more vaccines by the end of the month. I wanted to ask you if you can say now, like where are we getting those specifically from, and how much?
Well, we're still trying to tighten up the logistics of when exactly they're coming in. We're expecting some vaccines, as you know, from Sinopharm, which is a donation from the Chinese government. So those arrangements we are currently trying to tie up. We're also working with a bilateral donation, and again trying to tie up the arrangements for that one as well. But our time frame, it looks like the end of the month, and we should be getting in quite a substantial amount of vaccines. With COVAX, now that the AstraZeneca vaccine has been approved by the WHO, we are expecting to start receiving vaccines from COVAX, and they had promised us to give us for 20% of our population. So those vaccines hopefully would start to come into Guyana very soon.
All right. We had spoken about the record keeping and so on. I wanted to ask you about the specific system that we have in place that you had spoken about before, but I wanted to know if there's a database that can be accessed by other agencies that perhaps would require that information at some point.
For the immunization?
Yes.
The data is actually quite confidential, so while we maintain a record in the ministry, it is for our purposes. And with vaccination, when you come to get immunized, there's on the vial itself, that vial, there's a number, there's so many doses in that vial, and that vial is also within a broader group called a batch, and that has a number. So when we give you an injection, we are actually stating from which batch you got it, the date of expiry, and a whole host of other information goes on the information that we collect, and then who received it. So if perchance there's any side effect, we can go back and trace which vial this vaccine actually came from, and if there's something wrong with that batch and so forth. And so we collect quite a lot of information pertaining to that, but it's kept confidential. We also would need the information to be able to call the person, because most of these vaccines are vaccines where you require a second dose within 12 weeks. And so we use the information to make sure that we remind people to come back for their second dose. So, yeah. We have a database, both manual and electronic.
All right. A thought that just crossed my mind. Persons who need to travel, let's say when they would have gotten their vaccines and so on, do they still need to present a PCR test when they're traveling?
So once you complete your vaccination, you will get your card. So once you come for the first dose, you get your first dose, you're given a card, and it states that you got your first dose. When you get your second dose, we enter it again, and you'll get your card with you. Now, even if you're immunized, you still would be required to do a PCR test. And the reason being is that, as you would know when we talk about the efficacy of the vaccine, there's still, if none of the vaccines are 100% efficacious, which means that it doesn't prevent 100% of the infection. Therefore, that small percentage that is there, people can get infected. And if they can get infected because they have been immunized, they might get it in a mild form. But that doesn't prevent them from transmitting. So as more people around the world now get vaccines, the scientists are now observing to see whether people who have received vaccines, how much of this they can transmit, and the infection, if they can transmit this infection to others, and if it's going to spread and so forth. So that's something that is still under investigation. So the bottom line here is, even if you have received your 2 shots, you would still need to do a PCR test if you're traveling to another country. And those countries would require it, and therefore, if you travel, you have to produce that PCR, or in the case of the US, an antigen test. This is something that we have raised at the level of the Pan American Health Organization, because I know a lot of people would be asking this question, and we have also raised it at the level of the WHO. And so far, the advice has been that we continue to ask for the PCR tests, and with the current investigations that they're doing, when they complete those investigations, if the finding shows that they can change that advice, well, then they will change it. But as of now, you still have to do the PCR test.
All right, thank you, sir. In terms of our COVID-19 vaccine education, we had spoken about immunity of the vaccine last week. Today, we want to ask, how quickly after vaccination does the vaccine protect the recipient?
Well, what would happen is that immediately after you get the vaccine, it starts working in the body. And one of the main things is that the vaccine would trigger your body immune system to start producing antibodies. And so over the next several days, the level of antibody production goes up. And in most of the clinical trials with the AstraZeneca vaccine, by the 22nd day, they were able to show that nobody got hospitalized after the 22nd day. So it shows that the level of immunity that you would have developed is really strong, and it protects people from being hospitalized, and which is a good thing. When they did the clinical trial, they compare persons who received the vaccines with persons who did not receive the vaccine. And in the group that did not receive the vaccine, by the 22nd day, there were 14 persons who ended up in the hospital, as compared to 0 in the group that received the vaccine. So what that is really showing you is that the vaccine is really protective. And by the 22nd day, it has really confirmed a high level of protection for the persons who receive it.
All right. Our second question, what is the current status of COVID-19 vaccine research in children and adolescents?
The data for children is not available because they simply did not do clinical trials among children. They are now conducting those, and the different vaccines that have been in use, whether it's Pfizer, Moderna, and of course the AstraZeneca. Now studies have commenced to use children. So I know that there were two categories that they were looking at, from 15 to I think 9, or 15 to 12, and then a low age group up to age 6, I think. So these studies will probably get the results maybe in another 3 to 4 months, and then we'll determine how we move forward with those. I think a lot of the studies in children would have to do with dosing because of the weight of the child and the height and so forth. So dosing would be one of the requirements. They have to look maybe at a smaller dose for children, and to determine what exactly would be that small dose, that is what these trials are trying to ascertain. They're also looking at the use of vaccines in pregnant women, and again, new trials are going to be conducted with pregnant women.
All right, Minister Anthony, thank you so much for speaking with us today.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.